Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
I think there are hundreds of thousands of people out there who have Lyme disease who have no idea they have Lyme disease. There are doctors out there who aren't looking for it.
He just kept saying, you don't have Lyme.
You don't have Lyme disease.
You don't have Lyme.
A controversial film intent on exposing the hidden dangers of Lyme disease is ticking off a lot of people. Hello, I'm Lou Davis in for Jeff Salkin. Tonight we're devoting the entire program to Lyme disease. MPT aired the documentary Under Our Skin Sunday, and tonight we're going to hear from medical experts on the front lines in the Lyme battle. We'll also meet one patient who's been fighting the illness for a decade.
I know what my bad days are like, and I do my best to try to prevent them. So to know that I could get worse, that's not something I'm looking forward to. The unknown is pretty scary.
According to the Centers for Disease Control and Prevention, Lyme disease is caused by bacteria transmitted to humans through the bite of infected ticks. It's the most commonly reported vector-borne illness in the United States. Typical symptoms include fever, headache, fatigue, and a skin rash. And if left untreated, infection can spread to joints, the heart, and the nervous system. Most cases of Lyme disease can be treated successfully with a few weeks of antibiotics, but not all, and the diagnosis can be difficult.
Over the last 12 years, I've been diagnosed off and on with lupus,
chronic fatigue syndrome, Crohn's disease,
fibromyalgia,
lupus, fibromyalgia, MS,
fibromyalgia, rheumatoid arthritis.
Doctors thought I had ADD.
Chronic fatigue syndrome,
Parkinson's disease,
syphilis, multiple sclerosis,
MS to ALS to nothing.
They were pulling anything out of their hat they could think of.
Doctor after doctor after doctor after doctor after doctor, misdiagnosing her, putting her on some medication that didn't work, or just thought we were both nuts.
The film argues that persistent infection with Lyme disease is responsible for a variety of debilitating symptoms.
When I got diagnosed with Lyme, I thought, great. Oh, fantastic. Finally, I'm going to get rid of this thing. Course of antibiotics, I'll be good to go. I could never have imagined that it would be this long, with the possibility of being forever. Lyme pushes you to the point of, what do you want? What are you living for? It's not enough just to be alive.
Here's what Dr. Paul Auwaerter, clinical director in the Division of Infectious Diseases at Johns Hopkins University, told our producer. Lyme disease can be successfully treated with 10 to 28 days of antibiotics. Prescribing for longer periods of time or taking combinations of antibiotics yields no additional benefits, such as speeding recovery, and may cause dangerous side effects. Lyme disease patients who continue to suffer after recommended antibiotic treatment should seek advice not from a movie, but from credible doctors who treat all kinds of infectious diseases, and doctors who can make the right diagnosis and prescribe appropriate treatment. All right, in our studio now is Dr. Robert Edelman, a professor and associate director for clinical research of the Center for Vaccine Development at the University of Maryland School of Medicine. And joining us by phone is Dr. Eugene Shapiro, professor of pediatrics, epidemiology, public health, and investigative medicine at Yale University. We need to point out that Dr. Edelman is one of the authors of Lyme disease treatment guidelines issued by the Infectious Diseases Society of America. You guys have long titles, I can say that for you. Let's start with Dr. Shapiro on the phone. And we have to assume, I think, that most of the people watching tonight did not see the show yesterday, so let's get to some basics first. The program said that Lyme's is now a national health crisis. Would you call it a crisis, Doctor?
No, I would not call it a crisis. We're quite concerned about patients who are suffering, but the symptoms that are portrayed in the film, while there are, the film tells compelling personal stories, for the safety of patients, it should not be used in the place of scientific evidence. These symptoms are shared by many, many other diseases, and we strongly suggest that patients who are ailing and suspect that they might have this should see a competent primary care doctor who can explore the full range of possible causes of their symptoms. If you only go to a Lyme literate doctor, you're likely to be diagnosed with Lyme disease because that's what they do. If you go to Midas, you're going to get a muffler.
But why is it so hard to diagnose? Why, why this problem?
Well, Lyme disease is not hard to diagnose generally. The problem is with the patients who have these chronic symptoms, and the scientific evidence overwhelmingly is that Lyme disease is not the cause of the problem. And in fact, one of the things we're very concerned about is that patients who do have these problems, and let me be clear, I'm not saying the patients don't have problems or that they're not suffering. Clearly they are, and we're very concerned about the patients. One of the problems is if they get wrongly diagnosed with Lyme disease, that their real underlying problem isn't going to be addressed. Furthermore, long-term antibiotics have been shown by, we've had more than 30 years of solid scientific studies now. Long-term antibiotics are not beneficial and are associated with all kinds of serious harm, including potential death for the patient and the production of antibiotic-resistant superbugs that are dangerous both to the patient and to the community at large.
Dr. Edelman, let's talk a little bit about what a person should look for if he thinks he's been bitten by a tick, if he sees this rash. How should I deal with it as a patient?
Well, when you see the rash is a round circle. It's like, call it a target lesion. Usually it surrounds where the tick has bitten you. And a certain number of patients, they don't have, the tick has dislodged, they've never seen the tick, but the rash is very characteristic of Lyme disease. There's very little else that can look like it. In fact, it's so characteristic that the diagnosis is usually made on the basis of that. It's an expanding, round, reddish, somewhat warm, a little bit raised rash at the site, and it is enough to trigger a treatment with antibiotics. This is particularly true if you're in Lyme endemic areas of the United States.
Are we in that area here?
Well, we are indeed, here in the middle Atlantic states. Yes, and so that's how one essentially recognizes the Lyme organism and its effect on the body initially. Occasionally, you'll have an individual that the rash has disappeared, they've never seen the rash, and it goes on to cause problems with the nerves of the eyes, it's classical, problems with the heart, and in these situations you have to do serological testing and other testing to try to find the organism.
Okay, we're going to have to put a microphone on you, so let's go back to Dr. Shapiro on the phone for a second. Dr. Shapiro, what is this thing about chronic illness, chronic Lyme disease? There's some people that say it doesn't even exist.
Well, in fact, there is no diagnosis for chronic Lyme disease. The diagnosis has largely been that a Lyme literate doctor pronounces the patient has Lyme disease. In fact, scientific studies that have looked at that have found that the vast majority of those patients have no evidence of ever having had Lyme disease, either by blood tests or by history.
But what about these people that get really sick?
Well, again, let me make it clear. We are very concerned about these patients. The issue is not whether they're sick or suffering. Clearly they are. The issue is whether it's caused by Lyme disease and whether treating with prolonged courses of antibiotics, which is frequently what happens, is beneficial or harmful. There are certain situations where longer courses of antibiotics are needed, like tuberculosis, where we know that the benefits outweigh the risks. In Lyme disease, first of all, it's clear that many of the patients that have been labeled as having chronic Lyme disease, in fact, have something else. Number two, it's clear that the risks of doing harm with antibiotics far outweigh any potential benefits, which in fact have been shown to be negligible.
Okay, we saw in the program that anecdotally at least, a lot of people were cured or helped by these large doses of antibiotics, and we're going to meet someone in the program tonight later again. Why not do it? I don't understand why.
Again, the reason is, first of all, there have been many large-scale randomized clinical trials, which is the scientific gold standard for testing. The FDA does this to test all new drugs, and if you want to find out if a therapy is effective for a condition, that's what you do. All of the studies have shown that the antibiotics are of no benefit. Now, that doesn't mean that people who take antibiotics don't get better. In fact, in one of the studies, in many of the studies, there's improvement. The problem is, it doesn't matter if you got a placebo, which we know has no effect, or the antibiotic. In fact, one of the studies, 40% of the patients who received placebo improved. So it's, in an anecdotal sense, taking antibiotics and feeling better doesn't mean that the antibiotics are the reason that you felt better. Right. It may have something to do with the belief that this doctor cares for me. I'm doing something to help myself. It's very complicated, and we don't know all the answers.
It is complicated. Dr. Shapiro, thank you very much for being with us tonight. Dr. Edelman, this is also in the program been called a political disease, political problem, and that's getting in the way of finding a cure, of finding a way to treat this problem. Is that the case?
Well, it has a lot of emotion involved with it. You're going to hear from patients, probably the next person on this program that you're going to have. She's been affected, she feels, and her disease has responded to long-term antibiotic treatment, and there's a lot of people out there who feel that they are being subjected to discrimination by the medical profession, the conventional medical field, and they feel that the doctors are not well informed of Lyme disease, and everyone should get antibiotics because there's really nothing else that helps them. And there's a lot of emotional commitment. The people are very, very sick. They have a lot of fatigue, lack of energy, etc. So they're really desperate to find answers. And
let's take a phone call from one of our viewers. Don, you there?
Yeah, hi. A number of years ago, my wife showed some of these symptoms, but she didn't have the characteristic rash. But I did get her to our family physician right away, but I still had to push very hard to go up the chain to an appropriate specialist. We wound up at Hopkins, and the sophisticated blood tests showed that she did indeed have one of the other two tick-borne diseases, babesiosis. So she got the antibiotics. But my experience is you're very unlikely to get appropriate treatment in a timely manner.
Is that the case, doctor?
In some cases, it may be certainly true. I mean, some doctors are not are rapid enough to make the diagnosis, and therefore the decision to treat with antibiotics is delayed acutely.
A couple of years ago, I pulled a tick off my body, and there was a little round rash, and my doctor gave me 2 weeks of antibiotics prophylactically.
Okay.
Is that the way to go?
Well,
whenever someone comes in with a rash?
Usually when someone has a little round rash, they usually wait till it gets about a little bit larger, but practically speaking, many doctors will treat before that occurs. After 2 weeks of treatment, if indeed that's what you've got, you will be satisfactorily cured, almost 100% of cases. That's the good news. The other news is that sometimes this little round circle has to do with an allergic response to the saliva in the tick that injects into you when he bites you, and it's not Lyme disease at all, so that you've gone through 2 weeks of antibiotics for no real gain. But even then, the amount of side effects one gets from 2 weeks of antibiotics is, in most cases, unlikely to do you any harm. So that's the reason it's used.
Well, we've got a call now on line 6. Here we go. Are you there?
Yes, I'm here.
Go ahead, Susie, right?
Yes, I'm Susie from Frederick County, Maryland.
Mm-hmm. Your question?
I went undiagnosed. Actually, an infectious disease doctor told me once when I had anaphylactic shock and serum sickness is what they told me I had. One infectious disease doctor said, "We think you have Lyme disease, but that would mean your symptoms are such that it would mean you've had it for a long time. So we don't think that's what you have, but you can take the 6 weeks of antibiotics if you want," which I took. And then I had symptoms for 10 years, and it got into my brain. I was in so much pain for years and years. Finally, a doctor diagnosed me with Lyme. I've been treated for 4 years on antibiotics and other drugs, and I am so much better. Of course, the pain is gone in my head, my neck, my arms. I have neurological damage. I have other damage that my brain I started to be able to think better. I wasn't able to concentrate and read. I couldn't find my way home. Now I'm functioning much better, but I do have damage, long-term damage.
Susie,
but the antibiotics have helped me tremendously.
Susie, thank you. Doctor, is there any hope that, is there any progress being made in diagnosing this stuff early?
The tests are out there to be used. They're fully utilizable if they're used correctly by laboratories that have been certified to test for Lyme disease. Unfortunately, many laboratories are not testing for it correctly, and people are being labeled to having Lyme disease when they indeed don't have Lyme disease. This is a big problem. So that they get a course of antibiotics and they don't get better immediately, and they continue with the antibiotics, so they're being misdiagnosed for that reason. We don't know why some people, very small proportion of people, as I've said to you before, 5% or less, go on after recognizable Lyme disease. They go on to develop a secondary syndrome of fatigue and whatnot that lasts for 5-6 months and beyond. And such individuals don't respond to the antibiotics. We don't know why.
Dr. Robert Edelman, thank you very much for being with us. One of the Lyme disease patients in the film is a Maryland woman who will join us next in the studio. And here's just part of her story.
We are driving from Orlando up to North Carolina. It's a little over 500 miles, which is the closest spot that we have to Florida that actually has a clue about Lyme. My biggest fear is that treatments would be unsuccessful. She could continue to have a downward spiral. Neurologically, she could have things that are irreversible.
Hey, how you doing?
While we're optimistic that Mandy will steadily improve, I'm skeptical that it's going to be smooth sailing. She's so fragile, and her central nervous system is so irritable. It doesn't take a lot to set her off. We have to figure out what's the best way to treat you intermittently, to get you to the best place so that your immune system is more in charge. So that's a tricky business.
He said, we're gonna have to do 6 to 8 months of antibiotic therapy. We'll have to put a catheter in, to your superior vena cava, and then you're gonna probably get worse.
Let's just do one at a time. Let's do this one, and this is as needed, right? Lorazepam, and here are your supplements, that's fine. These are all fine.
All right, thanks for coming in, Mandy Hughes. Let's start with a little bit of history. How did this all happen? How did you get it?
Well, I was living in Maryland, and I got a tick bite, and I had a bullseye rash, and unfortunately, they weren't sure if that really determined that it was Lyme disease, and that was back in 1996. And I was treated with 2 weeks of antibiotics, and that sort of just put it in remission for me, and then it came back.
And then what happened? As you got progressively worse, were you able to get treatment?
It took a while. I had pictures of the rash. My mom was a great mom, and she took pictures, and I took those into appointments because she felt that there might have been a connection. I thought that it might be something different, and when I would take in the bite, and then I had a disseminated rash as well, and they would say, no, Lyme can't do that. So it took a while.
I mean, we saw some video of you in that program where it looked like you died. You actually stopped breathing.
Oh, well.
You're doing okay now, I guess, huh?
Yes, I'm doing very well now.
Any residual effects?
No. No, not for me, no. I did get much worse, unfortunately, and it wasn't from the treatment of Lyme. Unfortunately, there was the diagnosis of Lyme would, I guess, confuse people. So then when I would be sick and I would go into the hospital, they would sort of dismiss me.
Now, did you have problems with insurance?
I did, yes.
Tell us about that. That was also mentioned in the program, that there is now a big controversy about whether insurance should cover this whole thing.
Well, there's a lot of different species of Lyme and other various organisms that can live in a tick. So it's sort of hard for them to code all of those, I suppose. So you don't always get coverage.
But do you feel you got the treatment you needed?
Yes, I do. Finally,
in a timely fashion?
No. Unfortunately, I think if I had been given maybe more antibiotics originally than the 2 weeks, I believe that I wouldn't necessarily have had to go through all of that.
Well, for those who didn't see the program, tell me how bad it really got for you.
In 2005, I did almost die. Unfortunately, I'd contracted Pseudomonas, meningitis, pneumonia. Both of my lungs collapsed, and I went septic. My blood pressure was 70/30. I had 104 fever.
And how did they bring you out of that?
A lot of antibiotics.
So it's all antibiotics?
Not all, no, not always, but for me at that point, yes.
Now, you heard what some of the doctors said to us earlier in this program. You obviously don't agree with them.
Well, it was interesting how they said it was okay to prescribe long-term antibiotics for TB, but it wasn't. It would create resistance of microbes if you did the same with Lyme. You can also get long-term IV antibiotic therapy for acne.
Now, some doctors, as we saw in the program, also are losing their licenses and the right to practice because they are treating Lyme disease patients. Chronic.
Outside of the parameters that currently exist.
How do you feel about that?
I think that the disease, obviously, we need to develop some new testing and we have to do some research. Because if there's several different strains of Lyme that can be out there, then not all of the tests are for that.
Yeah,
it can be missed.
Yeah, it's almost hard to believe that something as small as a tick like that can.
I know.
Can.
It's like a mini syringe. I know.
And what's the prognosis? What are the doctors telling you now? Are you cured?
I think it's just that it helps your body get control of the disease again. I think that I still have it and will have it. Now, at this point, I don't have any residual, and I haven't been on antibiotics for a couple of years.
So is there anything you're doing, anything you have to do?
Nope.
You got some advice for people who are going through the same kind of thing you went through at the beginning?
It can be scary. When I was getting really sick, it was much more than fatigue and, general, issues with muscle weakness and things like that. For me, it became really complex. So it can be scary, it can be frightening, and you just have to be patient and persistent, and eating right and getting enough sleep and hydration also helps.
Why do you think the medical community is so divided over this thing?
I think that maybe what it originally was in the 70s has changed, just like anything else. I mean, there's resistant strains of TB out there right now, and if you think about all that a tick can feed off of, there's probably a lot that tick can hold. And so I think that it's a lot different than the 70s when they first found it.
Yeah, now you've actually done a lot of research on this thing. The environment is changing, and the humans are taking over the habitat that used to belong to animals. This is making it worse?
Well, you think about all the pesticides, all the different chemicals that are out there. I mean, it's just it's a matter of time before something like that would change.
Yeah. Mandy Hughes, I want to thank you for coming in tonight and talking to us. You are an inspiration for us. Thanks for watching this special edition of Direct Connection. You can go to our website, mpt.org, click Programs, and then click Direct Connection for streaming video of tonight's programs and links to all of our guests. Good night.
This